Hi, my name is Ananda Breed. I'm a professor of theater at the University of Lincoln and principal investigator of the Mobile Arts for Peace at Home project, online psychosocial support through the arts in Rwanda, funded by UKRI GCRF Newton Fund. It was the 22nd of March, 2022. The government of Rwanda had mandated a 2-week lockdown that extended into April, historically marking the month of mourning in Rwanda, to commemorate the anniversary of the 1994 genocide against the Tutsi, when over 1 million Tutsi and Hutu moderates were slaughtered during a span of 100 days. During this critical period, when the lockdown and anniversary of the genocide overlapped, I received numerous WhatsApp, email messages, and phone calls from MAP participants who stated that MAP was needed now more than ever. In a phone call from colleague Chast Uorohorai from Wasinga Nyamanzi, he stated, many mental health service users are now locked in their homes and in isolation. They feel the memories of the genocide alone, when normally they would be coming together to tell their stories and to support one another. In response to this need, researchers from the University of Lincoln, University College London, Institute of Research and Dialogue for Peace, and University of Rwanda, psychosocial workers from Wasinga Nyamanzi, and educators and young people from 25 pre-existing MAP schools and clubs created and implemented Mobile Arts for Peace at Home, online psychosocial support through the arts in Rwanda. Our aim was to research the prevention of, response to, and awareness of mental health and the promotion of psychosocial well-being among youth, families, and community members through an arts-based, culturally informed approach, responsive to the needs of participants. Here are our research questions that focus on the use of arts-based approaches using online arts programs for psychosocial well-being, advancing digital innovation in terms of mental health provision and response services in Rwanda. First, to start with the context. In Rwanda, psychosocial services provide an important contribution to building individual and community resilience, social cohesion, and trust. The lack or absence of trust has been shown to not only affect victims of the genocide, but to have transgenerational effects on young people. A recent report from the Ministry of Health evidenced the limited uptake of mental health services. Although most of the population are aware of where they could seek support for mental health, 61.7%, only 5.3% utilized existing mental health services. Thus, MAP at Home sought to enhance the uptake of mental health services by creating a culturally informed approach using Kinyarwanda proverbs and cultural forms that enhanced social interaction, and engaging a therapeutic model that included professional psychosocial care alongside community-based peer-to-peer support through the arts-based workshops to reduce the stigma surrounding mental health. MAP at Home trained mental health providers who then supported online and face-to-face group sessions within their respective communities and linked mental health service users with mental health providers at health centers and district hospitals. I'd like to emphasize here the importance of taking a culturally informed approach to the project, both in terms of culturally specific responses to mental health, but also in relation to the research design. At the beginning of the project, the MAP team ran a series of workshops in 5 districts to understand key concepts like home and mental health. The concept of home in Rwanda is closely linked to not only the family, but the surrounding community as well. Thus, the importance of group and community-based approaches to mental health and well-being. Mental health and well-being are viewed as relational to other people and to society, and encompasses notions of healing the heart and healing the social and emotional wounds. This reflects how mental distress is conceptualized within Rwandan culture as arising externally and within the context of social interactions and events. Additionally, it was important to integrate participants with lived experience of mental health into the design and delivery of the project, working with harder to reach communities during the lockdown period, including young mothers, former drug users, and mental health service users. The project team worked together to co-develop the research tools, to facilitate the workshops, and to collect the data. The workshops between November 2020 to August 2021 included 108 research participants who engaged in monthly online workshops. Smartphones were distributed to research participants at the start of the project, and monthly data bundles facilitated their ongoing participation. We conducted a series of preparatory project startup workshops to increase the digital literacy of participants. Monthly Map at Home workshops focused on the themes of naming emotions, building trust, sharing stories, and solving problems through Kinyarwanda proverbs, games, visual exercises, music, storytelling, images, and movement. Initial findings, evidenced through pre and post surveys, interviews, observation notes, and artistic outputs, illustrated a shift in the attitude and behavior of research participants from feelings of depression and isolation to connection and joy, alongside increased self-confidence, the ability to express emotions, and increased access to healthcare providers. Here you see a timeline of activities ranging from the scoping visit to training workshops, monitoring, evaluation, and learning, and the development of our resources. Just to clarify the process of how the online workshops evolved each month, Chast and I would conduct a workshop with the youth and adult trainers and psychosocial workers to create the curriculum. Then they would adapt the exercises to be delivered in 2-hour workshops for each of the 5 districts on a monthly basis. Following the workshops, psychosocial workers would contact individual participants through phone and WhatsApp to check in about their well-being and to collect any artistic tasks or feedback. One exercise during Map at Home included the use of a Zoom whiteboard function for participants to share their rain and umbrella, metaphorically to share their problems, rain, and ways that they protect themselves from problems, umbrella. The facilitator prompted participants to share varied experiences that related to the rain that had affected their lives. Participants responded with stories related to surviving the 1994 Rwandan genocide against the Tutsi, being raped, being orphaned, losing work, living in poverty, hampering education equality for all, experiencing isolation and stigma related to being young mothers, etc. The umbrella or protection that had been used to either ward off or to manage the rain included praying, talking to friends whom one can trust, helping others who are in need, listening at a deep level to share the same emotions and common understanding, gaining employment, receiving the support of others, and practicing self-love. Throughout the duration of the Map at Home project, participants shared their experiences and feelings through visual images that they often drew and then posted to WhatsApp or shared during the workshop. Some of these images are presented here. Here are some drawings that emerged from some of the Map at Home exercises. Now to move on to some of the testimonials from our participants, and then to close with some notes about the sustainability of the project. This testimonial from a female participant stated, "It helped me regain trust and have hope for my future. It also helped me to stop isolating myself from others. I also want to thank you for giving me this phone. I can connect with my friends and talk to them whenever I have a problem." This is a quote from a trainer who stated, "It provides an opportunity to many vulnerable people to connect where they might be. It spares time for the therapist to care for many people in a short time. It gives a chance to individuals of getting the support in whatever situation they are in. It reduces stigmatization in the way that people are free to consult, knowing that no one will notice that they are visiting mental health care settings as well. And to close, in terms of sustainability, Map at Home evolved from continuous collaboration with partners and research participants, building on previous projects. We have also been working with the team of MAP youth and adult master trainers and psychosocial workers as researchers, and data collection is managed on a local level. MAP at Home is informed by the local context through locally negotiated pathways to impact, working with civil society organizations, government bodies, and engagement with community and policy level decision makers. We would like to take this opportunity to thank our research partners and research participants. Merkoze Chani.